Hi everyone, welcome to Power Monday. So very glad for everyone to be here tonight. So today we are actually very glad to have a special speaker with us tonight. She's Dr. Chia. She's actually in Sarawak now. Okay, so today I shall introduce more about Dr. Chia. So she'll be actually talking more about Proteoglcan and also type 2 collagen. So as you know, Thanksai, one of our two-star products, Profit and Joyful. So she'll be covering these two products today. Okay, so let me introduce Dr. Chia. She actually is a medical practitioner. Okay, so she has served the medical line for the past 15 years, okay, practicing in Kuching, Sarawak. So currently, she's still a general practitioner in the medical clinic and also co-managing nursing homes and confinement centers throughout Sarawak. Okay, so she has actually a lot of experience in emergency medicine, family medicine, health screening, maternal and child health in government and private hospitals in Sarawak as well. Okay, so just a bit more about how Dr. Chia started using the products. So actually in May this year, so she actually knows one of our leaders, okay, Bibiana Lam, also in from Cebu. So she actually saw Bibiana, her face, a lot improvements on her face. So actually she asked her, and parents, I think over 70 years old. So they also have near issues. Okay, so she decided to buy the product and her parents to try. Okay, so her parents actually tried it and had very good results. And of course, Dr. Chia also herself has actually taken the products and have very good results. So today we actually are very honored to have Mr. Dr. Chia with us to actually explain more, not just the products, but also scientifically, how does proteoglycan and type 2 collagen helps our body in many, many aspects. So put our hands together and actually welcome Dr. Chia.
Hello, hello, hello. I'm Dr. Chia. Okay, thank you for inviting me today. Okay, a bit of my background. I am a general practitioner, and I involved in a lot in family medicine, and also a visiting doctor for maternal child health confinement centers, elderly medicine, and for the past 7 years, I was working in a private hospital, mainly on a health screening issue. So a bit of history on how I get to know Thanksai. Actually, I saw my mentor, okay, Auntie Bibi, my best friend's mother. She looks different. I have been constantly seeing her on and off. She looks totally different. She's glowing. She's healthy. She looks healthy. She's happy, given by her age. So I started asking, and she introduced me to these products. So initially, I was quite, I was like, okay, I will just try out. Okay, because my parents, they're 70 years old and they have chronic issues like high blood, diabetes, fatty liver, and especially my mother, she has this chronic fatigue. So she always feel tired with a lot of other housework and with my her grandkids lah. So she tried out a lot of supplements. We did investigation, medication. It doesn't really solve the problem because everything came out normal. So I just decided to let them try it out. The first day, the second day itself, my mother gave me a very positive feedback from the products. And subsequently, we spent more and more time and checking on my parents and knowing the products. So throughout my medical career, I came across a lot of chronic patients with chronic illnesses. Okay, and nowadays those are chronic disease. Patients are generally getting younger and younger. My youngest type 2 diabetes is not genetically, it's type 2 diabetes is 18 years old. That young. Yes, it's getting younger and younger. And most of us, we will only seek treatment when we see doctors. When we have symptoms, we feel unwell. We only seek treatment in the hospital. So in fact, I believe that prevention is always much better than cure. It's never too late to start caring of our health now, although some may think that we are young. Okay, so if we start today, definitely we will be a better self tomorrow. Okay, so let me talk about basic fundamental structure of our body. So once we understand, then we will know that what are the products that they can do to our body. Okay, so we have our body, the smallest unit. The smallest unit is cells. Okay, that is our basic fundamental unit. So these are all different cells. We have different cell types. And all these cells, but their basics are almost the same. So they are specialized in different function, and they group together, they become different tissues. They have different function. They have a smooth tissue, they have a vessels tissue, they have nerve tissues, and eventually they develop into different organs. Okay, so organs, they connected and they develop into a different system. So basically we have more than 10 systems running our body, and that is us. Very complex. Humans is very complex. So it is not like, oh, today I have my sugar issue. I just take something which reduce my sugar. It doesn't really help, because if my control is not as well, it will eventually cause other system failure as well. So it is all interrelated. It is not like I have some heart issue, I settle my heart, my lung issue, I settle my lungs. No, actually it's very complex, it's all interrelated. So back to the basics, it is our cell health. So I would say every disease is started from our cell, each cells. So our body, we have 30 to 40 trillions, okay, trillions of body cells in our body. So they will have a new regeneration, and they have some old shedding off of our cells lah. All right. So this is my cell, our cell. Okay, in the whole body, my skin, my eyes, my hair, everywhere. So in between the cells, we have this extracellular matrix. We put it as the space, the medium in between two cells. Okay, extra means outside. Cellular means the cell. Matrix means like a medium. Okay, so in short, we call it ECM. Okay, imagine our cells, they are without this ECM. Okay, imagine these pebbles, different pebbles are my cells, and it's all air. Okay, there's no protection, no buffer, no filter, nothing. So meaning all these cell surrounded by air, they are very, very susceptible or prone to any external injury, chemical, bacteria, virus, any injury, lifestyle injury, inflammation. So, and the structural integrity won't be there, and our cell damage rupture easily. Okay, but if our human body, we have this ECM, okay, it is just like a medium or glue, okay, connecting all my cells. So they act as a medium, okay, to protect my cells, to filter, to block whatever disturbance or damage or insult to our cells lah. Okay, and they have maintained the cellular structure integrity, make sure everything is organized. So if this ECM, it is throughout the whole body, it is very important. So the main ingredients in this ECM, we have this collagen, we have this hyaluronic acid, but we have this proteoglycan as well. So proteoglycan, I think rarely we heard about it. Okay, we have been doing a lot of research, more and more research on proteoglycan. So what is this miracle compound, proteoglycan, and why is it so special that it actually, by one small things, they can actually they have very beneficial for your health actually. So what is proteo? Okay, proteoglycan, proteo is protein, in medical is protein. Glycan meaning that it is saccharides, a sugar. Okay, so it is naturally existed in our body. It's not some new technology created by this company. No, it's actually naturally existed. So we found this we found this proteoglycan, these ingredients actually in the 1990s, way long back. Extraction, everything makes it very expensive. Okay, so where is proteoglycan located? It is everywhere. Okay, proteoglycan can be in different forms. So we generally categorize them by the content which is binded or connected to this proteoglycan, or by the size of it. So it not only existed at the ECM of our cell, also our whole body. Okay, example we have from our dermis layer, our skin. Okay, one of the largest organ from my skin, and it's at the dermal area. It's at the real skin, true skin area. That's where I have all my proteoglycans. So it holds up my skin. Okay, and we can find it in our bone matrix, in between our bone, or my cartilage, my tendon, my eye, my lungs. They have different purity of different ingredient of this proteoglycan, different types of proteoglycan inside. And this is an immunofluorescence stain by microscope. They stained. Okay, this is the evidence showing, oh, this by different staining. Look at all these different colors. They represent different type of proteoglycans in our kidneys. Okay, this at the arteries around the vessels of my kidneys. And this is a cross-sectional. They cut our kidneys halfway. Cross-sectional in my kidneys, all the subunit. You see, this is all full of proteoglycan. It's everywhere. It's not only my ECM, it's everywhere, in fact. So by this replenishing this good substance, this pure substance, we might increase or enhance our health status. Okay, so I mentioned back in 1990s, we found out that proteoglycan is mainly existed in the nasal cartilage of fish, okay, especially Japanese salmon. Okay, but it's very expensive. Previous extraction, they required 3 days extraction, and they managed to preserve around 20+%. Yeah. And they cost around 1 gram, if I'm not mistaken, 1 gram, it costs around 1.13 million ringgit in the 1990s. I do not think anyone is that affordable for everyone lah. Okay, so thanks to this Mr. Yoshiaki Kudo, okay, he's the founder of this biomatech company. They collab with 4 prestigious university from Japan. They discovered a new LPT, leaf protein technology, under the alkaline medium. They get to extract very pure, okay, they get to extract and preserve up to 90% of this proteoglycan from the salmon nasal cartilage, and they shorten the extraction time from 3 days to 1.5 hours. Okay, so this technology, they are awarded in 2012, okay, for having this such a great technology, and it's world patented. So it's only this company, they get to preserve that pure of proteoglycan in our products, so we can enjoy the goodness and of this very pure proteoglycan at a much affordable price. And these are all their global patent, their core ingredient patents in different countries. Okay, so actually in the market, they have different ingredients, proteoglycan, yes, mainly external or internal, but the highest, it will be around 20+%, 20%. So why we would spend on 20% where we can get a 90%? And this company, which is good, they opt for improvement. So next year, they will increase up 95% of this proteoglycan in our products. Okay. So what is so good about this product? Why I love this product? It's not only about, it's about health. Okay. So we all know that nowadays we know a lot of the disease they are associated with inflammation. Okay, what is actually inflammation? We have chronic inflammation, we have acute inflammation. Acute inflammation is mainly like I have fever, I have pain, I feel discomfort. I go to see the doctor immediately. They give me maybe antibiotics, maybe pain control, maybe anti-inflammatory products. Okay, I'm well, that's it. Okay, so at least you have a symptoms for acute inflammation. But nowadays, most of us, we have this chronic inflammation. Chronic inflammation, it can be due to our genetics, it can be due to our environment, it can be due to our bad lifestyle, Okay, smoking, cigarettes, high sugar food, all these cause inflammation. Okay, so the thing is, this chronic inflammation, they have no symptoms at all. No symptoms. So until you develop certain symptoms, it will be too late. For example, all this chronic inflammation, they are highly associated to aging. That's how my cell age, my organ age. And eventually they will cause metabolic disease or obesity. It is not the whole thing, it doesn't develop over 1 day or 2 months lah. Okay, it's over the years, and we are not aware of it because we have no symptoms. So I believe that I've seen a lot of patients suddenly last year, they check their sugar, okay leh, borderline lah. So they just like, okay, I just control. But the next year, they already developed diabetes. They're in a shock. But the thing is, to example, to become a diabetic patient, meaning that the body is chronically inflamed, and their pancreatic cell, they have this insulin resistance. Their pancreatic cell have lost roughly 70% of its function. So the remaining 30% have been working so hard to bring down the sugar. And when we check our blood sugar, it was on the high side or very high. Okay, so to have this type 2 diabetes, the friend will be here. Okay, our body age and my high blood pressure will be here. And all these unknowingly, it's not only your pancreas the issue or your high blood pressure issue. They will affect the vessels of the whole body. All this inflammation cause the vessels for inflammation of your vessels as well. So all this inflammation of the vessel aging, they will cause end organ damage. These are all due to this vascular metabolic disease causing end organ damage. Example, I have stroke. I have sometimes degenerative disease. It can be due to minor strokes. I have a heart attack. I have my eye issue, blindness, and at the same time, I have a chronic kidney disease. It does not develop one day. It is over the years. So if we realize this, of course, with a better lifestyle, and we can take something to reduce the inflammation chronically, daily, a supplement. So to slow down and delay the inflammation process. Okay, so I think it's worthwhile taking. Okay, and chronic inflammation also leads to cancer formation. Okay, so this slides, okay, this shows that it's a normal cell. Okay, if there is any acute inflammation, example, like viral or trauma or bacterial infection, something acute, or any chronic inflammation, genetics, environmental, bad lifestyle, all these cause inflammation to my cell damage. So if I do not stop the inflammation here, it might go into a damaged cell with a precancerous lesion. It's not cancer yet, but it's precancerous lesion. So throughout the years, it takes years, this chronic inflammation slowly, all these cells, they go haywire and they replicate a lot and they become the primary tumor or cancer, and eventually they might spread. Okay, it depends on what kind of cancer. But if we can do something, of course, we cannot stop everything 100%, but if we can do something to stop here, okay, to try to stop the chronic inflammation for long term, we might be able to reverse back or at least delay anything happen. Okay, and this proteoglycan, they were found out to medically, they will reduce the angiogenesis towards the cancer cell. Okay, what is angiogenesis? Angiogenesis is formation. Genesis is formation. Angio is blood vessels. So they will reduce the blood vessels formation to the cancer cell. So why this cancer cell? The cancer cell, they are also cells. Okay, they are being fed. That means that it's their nutrients, it's their food from all these blood vessels. So if I cut off their food, I bring down their stock, they have no food, so they starve them. Okay, so proteoglycan, they reduce the blood vessels formation towards feeding this cancer cell, and they also activates these NK cells, which is a natural immunity factors, these NK cells will actually work against tumors, so they will reduce the survival of the tumor cell. By all means, we try to reduce all inflammation effects and all kinds of factors which we can bring down the cancer from spreading. Okay, we might not totally stop, but they actually, certain extent, they can actually help. Okay, clear lah, huh? Okay, next. This is my favorite part. All women. Okay. We have been I think for me lah, huh? For me, I have been taking like collagen, the vitamin C, like collagen for my lifting lah. You know, I'm aging already lah, huh? For all the lifting, vitamin C to look brighter. Okay, retinols for all the wrinkles, the pores. Okay, and hyaluronic acid to boost up my hydration. That's usually what are the contents we have been taking. Okay, but taking this proteoglycan, first of all, they are in the thin sheets. Okay, they make it very easy to absorb. Okay, you just put it under the tongue. Okay, a sublingual, what you call sublingual. Okay, then the absorption is quite immediate, and they do not need to go through any harsh environment in the stomach or anywhere. So they were just being absorbed, and they go through absorption. Proteoglycan will be at the dermis area. Okay, so anything like example collagen or hyaluronic acid, we apply externally, it will be at this epidermis area. So honestly, epidermis outer layer is the dead cell, and they have to go through these like 1, 2, 3, 4, 5 layers to go down, and it's very difficult at the molecular level. The molecules is very difficult to go down. So why not I change my methods of all these anti-aging by taking it and I replenish from within, inside out. It be a better method. Okay, so and the conventional collagen, they are in a very huge molecules, very huge. So the absorption to my stomach with the pH 1, very acidic in my stomach. I wouldn't promise that the absorption will be 100%, mainly 16 to 20%. It depends on what kind of, what types and what are the molecules, how small of the collagen you are taking in. And they are pricey. Honestly, they are pricey if you are taking up that much. Okay, so next, this proteoglycan, okay, they have this effect. Once they go down, they absorb, okay, in my skin, they have a lot of proteoglycan. Okay, what do? They have anti-aging effect. One is they synthesize collagen. I'm taking in a factory. Okay, I'm taking a factory. I do not need to take collagen here, hyaluronic acid here, vitamin C, retinol A. I do not need that much. Okay, so I'm taking in a factory, and they stimulate, if I'm not mistaken, 5 types of different collagen, and they will boost up collagen lifting effect. One thing lah, lifting effect is there. Okay, and they have anti-aging effect, like it is similar to EGF. EGF is actually epidermal growth factor. This epidermis, this outer layer, growth factor. That means they heal fast, like kids, babies, toddlers, adolescents, they heal very fast compared to middle-aged women like me lah. Okay, so when this EGF, the more EGF you have, the renewal of your skin, the regeneration of your skin is more. Okay, is more. So proteoglycan, they have this similar EGF effect. They will actually replenish layers and layers, pushing up layers and layers. If we have any insult to my skin, that means my skin gets younger lah. Okay, so and they can actually reduce pigmentation by the melanins. Okay, so I will have multifunction here. One, my collagen, my lifting, okay, my minimize my pores, my wrinkles, to lift up, and I get a brighter skin, reduce my pigmentation, and also my skin regeneration. So it is like multifunction in one product. Where can I find such product? It's actually very good, and studies have shown that their moisturizing power exceeds hyaluronic acid. As we know that hyaluronic acid, they absorb water a lot. So their moisturizing power is 30% more than hyaluronic acid. So they absorb a lot of water. These are called body sponge in our body. Okay, so I give you an illustration now. Huh? It's like a spring. Okay, like baby skin. Okay, imagine this spring. They have a lot of these proteoglycan and collagen, and they absorb a lot of water inside. Okay, so if you have any external insult, they will go down here. External insult, pressure, or injury externally. So the spring will actually being compressed down and the water out. Okay, but once you eliminate your external injury, you eliminate everything, it recoils back, bounce out back. So it's like the elasticity can be restored in our skin. If aging skin, I do not think we have this kind of skin elasticity. So these are for proteoglycan can give us all this goodness and this effect. Eventually, the lifting, a younger skin, less wrinkle, less pores. Yeah, so it's actually age reversal for my skin. Okay, and a bit show you. Okay, this is my husband. He do not like any products on his face. Yeah, he never use it, unlike me lah. Okay, so for him, he had dry skin, but also oily skin. He have a mixture of both. Okay, so he needs, this is his dry wrinkle, but he looks skin looks oily and they have pores. So after taking 10 days, he take 2 to 3 sheets a day, depending on your body size and how much you have been needing it. Okay, really depends, pretty much depends on that. So he have bigger body size, he needs more. Okay, he needs more, and with a lot of hydration, because I realized that a lot of us, we are not taking enough of water, because our body more than 70% is water. They make out of my ECM, and I need this water to buffer as a medium for all this goodness to act. Okay, so it is like a synergistic effect. So you have to take 2.5 liters if you have no fluid restriction from your doctor. Okay, so you can see all these dry wrinkles, pores, everything is much refined. Okay, and this is my mother. I give her all the star products for mineral and Georgine X. Maybe the next round I'll talk about it. Okay, she had been taking Profil for 10 days, and I can see her laugh line and the wrinkle, the eye bag, this area actually is much being pushed up and hydrated. These are all taken by iPhone and without any color changes or any filter. Okay, it's totally true here. Okay, so yeah, this is externally, but my mother feel very comfortable after taking all these products. Okay, and this is me. Okay, without any makeup. Okay, so I've been on diet chronically for years, like, you know, female postpartum. Okay, we hate to be. I don't like weight gain. Okay, honestly, but because of the chronic diet, I have very bad this collagen deposition. Okay, so I have tried. If I want the fast effect, I would need an invasive procedure for filler. But I am a needle phobia. Actually, very scared of needles lah. Okay, so I've been taking this for a month. I can see that is lifted. Even up to now, it's much being filled up, and it's naturally. I do not need to be worried about any failure of invasive procedures. And my pigmentation, previously I had my pigmentation depigmentized by laser. But due to hormonal changes, after 2 weeks, they regrow back. Okay, they regrow back. So so the whole pigmentation is much reduced, and I realized my skin, they become clearer, and the color, there's some color changes, become fairer. Okay, because this anti-aging, they inhibits the this melanin, the pigmentation of my skin. Okay, so of course for long term, I believe that the whole thing can actually slowly maintain or reverse my external appearance. That's my favorite. Okay, all right. So this is some example from this confinement center. Okay, other research, they have some research, supportive research. They noted that this proteoglycan is not only for adults. Okay, for those pregnant ladies, this is the embryo of this the babies, our baby in my stomach. Okay, so during the initial formation, they need to implant in my uterus. Okay, so the embryo, the babies here, they need to implant in my uterus, and all these cells, they are full of proteoglycan, which meaning that proteoglycan can actually help a stronger implantation. And there's other studies showing that they can reduce post-delivery complication, make it an easier delivery for mothers. Okay, and all these proteoglycans can go through the placenta, okay, certain amount, and it benefits the baby. It helps in the embryonic development of the baby, from their bones, their skin, their brain cells, their eyes, their lungs, everywhere. It actually helps. Okay, so externally example lah, this example, and I all these pictures actually I get the permission from the parents lah. Okay, so commonly I've seen in newborn baby. Okay, they have this common rashes like heat rash lah, what we call neonatal acne. Okay, these are all small little spots, redness. When they grow fatter or they are hitty, they have more redness. And sometimes we apply medication, sometimes we don't. But the medication usually to reduce it, if it's a medication topical cream, it will be steroids. Okay, because anti-inflammation. Okay, so if I do not, the mother of this baby, okay, this is a different baby. This is commonly what I get the skin for babies now. Huh? Okay, so the mother, she took a proteoglycan, 1 or 2 pieces at the last trimester. Okay, she only get to know about this from Cebu. Actually, she's from Cebu. She take 1 or 2 a day during the last trimester, and she breastfed the baby after delivery. You look at the skin, it was honestly flawless. I couldn't find a rash, and majority, almost all the baby will come up, will deliver with dry skin, because they have this water retention after all the water excreted, and the skin is actually very dry. Okay, then they change the skin. But for this baby, honestly, look at it. There's no this is from iPhone. There's no a filter being taken. Okay, and it is honestly flawless. Baby skin, real baby skin, so flawless. So I believe it's the effect of this proteoglycan during the last trimester, and also mother breastfeeding. Actually, a lot of mothers, they notice the baby skin this way. They have been asking the mother, what products you have been taking. Okay, so it's actually safe for pregnant ladies and also breastfeeding mothers lah. Okay, and there's a bit more on other aspect of proteoglycans. It's not only for my ECM, not only for my skin. Okay, this is also for my nerve cell. Okay, studies have shown that all these proteoglycans, we are found in our nerve cell. It helps. This is my nerve. My nerve is at the brain and all my nervous system. Okay, so these proteoglycan, they are found it at the fine branches, the small branches branching out from the nerve. Okay, they help to increase the sensitivity of the nerve. It is at the perineuronal net. Peri means around, surrounding. Okay, neurons is this my neuron, the network of it. So it is, if there's any degeneration, meaning that the network will be shrinked, degeneration disease. Okay, so the studies have shown that they help to expand all these side branches. Okay, and if there is any insult, a trauma, a disease, okay, causing, like example, my brain, okay, causing any, they will activate the inflammation cascade, and which shows that there's proteoglycan will be surrounding all these lesions at the brain or at the nerve, meaning that they act as a barrier, trying to around the injury, trying to minimize the spread, the severity of the injury, and act as a barrier. Okay, studies have shown that, but it is still at the early phase. Most of them, they will have more studies to come. Okay, and I think everyone will be interested to know about kidneys. Okay, this is my kidney lah, my kidney. So what kidney do is, my blood vessels goes in and they have a filter here, my kidney. Okay, the small little filter unit, what we call glomerulus. Glomerulus. It is a zoom out here. Okay, the small unit, there's a lot, thousands and millions of units here. Okay, so what they do, they form a barrier. It's like a barrier here. Okay, it's like a net, a barrier. So they will selectively filter out. So they filter out the bad things, the bad toxins, the excrete as urine. Okay, so but they will preserve the good stuff like protein, like all the good electrolytes. Okay, not to go through my kidney. That is for normal kidney. Okay, but if the patient have some chronic diseases like diabetes, high blood pressure, or chronic kidney inflammation, okay, what happened is there is some changes at the barrier. So they make the barrier the bigger, the hole bigger, loosen up. So that means the protein, which is not supposed to be excreted, being excreted to the urine. That's how we get proteinuria, protein in my urine in a kidney disease patient. Okay, but it's not yet to failure, maybe on the way, maybe. Okay, so we have to take care of it. So studies have shown that proteoglycan can actually tighten the barrier. So they will slightly improve the function for long term, and they will tighten the barrier so my protein won't leak out that much, especially for those chronic kidney disease. They have these studies, more studies about it. Okay, so they will delay or the further damage of the kidney before going into dialysis. But of course, all this takes years to develop. It will take time for all the supplements to be absorbed to work. Okay, so they have studies saying that it is kidney friendly as well. Okay, right. Okay, so apart from kidneys, okay, the next thing is about my bone. So you see, proteoglycan is not only about beauty, it's about the health of every single thing, and it's multifunction. They function as everything. Okay, so it's in our bone health as well. So I believe that a lot of ladies, okay, if we have kids, each childbirth, okay, this is from this Harvard University. They have this research saying that after each childbirth, one kid, our body age 8.8 to 11 years old. My God, I have two kids. And this is excluding with breastfeeding. So actually, honestly, kids act as a little cute parasite. They are attached to mothers, and they get all the nutrients from the mothers. So if I can replenish and take care of my own nutrients, yes, I take care of myself. Okay, so and especially for ladies post-menopausal, my calcium loss is 3 times faster than my intake. So a lot of osteoporosis or osteopenia, brittle bone, the bone is very, very brittle. They can be prevented, but we have to do it earlier. It's not until I menopause or until I take my x-ray. My bone, there's a lot of holes inside. It's so brittle. Then I take some supplement, it will be too late. So start early. Okay, looking at my bone matrix. Okay, this is my bone. My bone is not solid totally. They have like little pores inside, and they have this organic matter and inorganic matrix inside. Okay, if they can't be truly solid, because if they are truly solid, they will be so heavy. I don't think we can even lift up our own bone. So it is actually they have some pores around, and it's a hollow structure. But the side of it, okay, what maintains the integrity of the bone? Okay, so it's all the matrix, the bone matrix. Okay, so bone matrix, they have two components. One is 30% is the organic, 70% is the inorganic, like calcium, magnesium, and other phosphorus, anything other ingredients lah. So among this 30% organic substance, okay, 90% of this organic is this within this 30%, 90% of them is collagen, and the remaining 10% is proteoglycan and water and others, etc. So we need collagen, and proteoglycan can stimulate collagen, and we need proteoglycan to actually maintain the structural, the strong bones. We need them. they can actually help to regulate and eventually help to prevent osteoporosis. That means the bone being too brittle, and it helps in calcium regulation as well. Okay, so you can see, example, this is normal bone. Okay, this is the unfortunate person with external injury, and that's a bone fracture. Okay, so the first thing is blood clots will be there. Okay, surrounding, and they have good clotting factors, and the clots, hematoma is blood clots. Okay, so after they sense the injury, the next thing my body, they try to stop and try to act as barrier, try to hold my bone. That's the first thing they do. So you can see a lot of fibers and cartilage around, and proteoglycan is the main components of all this. And subsequently, they will form woven bone, calcium, and eventually as good as new. Okay, so this proteoglycan can actually help to restore the bone remodeling and aid in healing of the bone lah. Okay, and next, leave at a lot of us, especially the older ladies, I think I can understand your feeling lah, huh? Okay, of this joint. Okay, further we look at our joint. Just now was my bone. Okay, now we look at our joint. So this is my tibia. This is my knee joint. Okay, this can happen in every joint, any joint. It's not only this example lah. Example of my knee joint, my knee. So this is my femur. Okay, my thigh bone, and this is my tibia and fibula, my shin bone. Okay, so in between the bone, we have proteoglycan, we have collagen, we have different matrix inside, and we have this lubricant in between. This is what we call the joint space. Okay, mainly the joint space, they have a lot of ingredients. Okay, they have type 2 collagen. Okay, they have proteoglycan. So type 2 collagen remains around 40 to 45%, 40 to 45% of type 2 collagen inside. And proteoglycan, they accounts for 30 to 35%. Okay, and the others is hyaluronic acid. So if we can ensure that all my joint, by taking this, my joint are protected. Okay, it will be good, because if there is arthritis, regardless it is osteoarthritis, okay, due to wear and tear, reduce of the lubricants, or rheumatoid arthritis due to this autoimmune disease causing inflammation and causing my bone to be painful. Okay, regardless, proteoglycans can help. They can help. First, they anti-inflammation. Second thing, they absorb a lot of water, act as a shock absorbent. Okay, so this is the bone. I can feel the pain, honestly. If we have any elderly at home, actually it's extremely painful. But eventually, to have that pain, it takes years to have these symptoms. Actually, it's not 1 or 2 days or 1 or 2 years. It takes years. Maybe she experienced it recently, but the wear and tear is already been there for years. We are not aware of it. Okay, so as the lubricant is much reduced here, it's getting thinner and thinner. Okay, you imagine your bone, they are having a hard surface, and this is the hard surface, very hard. So without any lubricant in between, the two hard surface, they are like grinding towards each other, and they have this friction. Oh my God, it's painful, very, very painful. Okay, I believe it is very painful. And of all this friction, pain, inflammation, and due to the uneven pressure, sometimes the pain starts here, then I will shift my pressure to this side. And eventually, due to the uneven pressure, they have these bone spurs. Oh, they added more to the pain. And slowly, they will erode and erode and erode, wear and tear, without the lubricants in between. They have the eroding cartilage, exposed bone. Yeah, this is very painful. So by taking proteoglycan earlier, okay, remember this slide? And my collagen and my proteoglycan, they absorb a lot of water. They act as a good spring. And if there's mechanical pressure here, they will force out the water. But once the pressure is gone, it will go up back, recoil back. So act as a shock absorbent. It's like a spring. Remember, it's like a spring. Okay. So this is a real X-ray. Okay, real X-ray. This is the normal bone. You see, it's so pretty. This is a knee. It actually happens in any joint. Actually happens any joint. It's not only in the knee joint, but commonly at the knee joint lah, because a lot of pressure and wear and tear at the area. So look at this one is my thigh bone. Okay, femur, my thigh bone. And this, you see this joint space, this is my tibia, my fibula at the shin bone. Okay, so you look at the joint space here, you have a space, meaning that when you move, okay, it is not painful. Okay, we don't really x-ray or appreciate this lubricant because it is naturally there. We don't feel anything until we lose it. Then the pain occurs. But once you feel the pain, it might be in this state. One thing is my lifestyle, one thing is my body weight, and one thing is wear and tear. Maybe I have previous injury at the area. All this accounts for the wear and tear of this lubricant. Look at this. Look at the lubricant. It is so narrowed. So can you feel the hard surface and this hard surface? They both grind to each other, the pain of it, and slowly they have bone spur and they have bone erosions. Okay, the eroding down the bone. And you look at the bone. This is, I believe, is an older lady lah. Huh? Okay, all this bone. There's this uneven hypertranslucency, this area like pores. Okay, this is actually an osteopenic bone. In contrast to this one, wow, very fine lines, pretty bone. This is a normal bone. So by taking proteoglycan, for long term, we do it fast. They can reduce the inflammation and they can add up 30%, at least 30% salvage here to bring it for long term. Of course, this whole thing, they take years to develop. A lot of the ladies, they said, I take 1 or 2 steps, still pain leh. But because our body needs a lot of them, it's a chronic issue. So it take be patient, take a couple of months and with a lot of water, because proteoglycan needs a lot of water to work as a synergistic effect. They need to absorb water. Of course, you have to give them water. Unless you are, fluid restricted by your doctor lah. This one is upon advice. Okay, so apart from this osteoarthritic knee, okay, they have this rheumatoid arthritis due to this chronic inflammation, body immune system, autoimmune system, they attack and they have all this inflammation around. It helps. Okay, so some, I think you would experience for long-term this knee problem. You go to orthopedic surgeon. Okay, sometimes if you are not that severe to do any surgery, they will ask you want some pain control, weight loss, physio, pain control, or sometimes they will give you steroids. Okay, but all this, it is not advisable to take long term. Short term, yes, and follow up, yes. Okay, so if there is any alternative before going, if it's end stage, sometimes surgery helps, but usually it happens in old elderly. Can they actually withstand any total knee replacement of the post-operative complication? They might be big bound, they might be painful, they might be infection, blood loss, uninfected metal, foreign body. They can have a lot of complication, and these are all other complications they have to face. So sometimes they might not be fit to go for surgery, but they're in pain. And they maybe have other comorbids. They are not, it's not good for long-term medication. So any alternative, you can think about it. Okay, think about it, any alternative. Also, proteoglycan can be a very good choice. Okay, and okay, if proteoglycan is the father, okay, now I'm talking about the mother. Okay, so as I mentioned just now, our joint, the lubricants, we have type 2 collagen, we have proteoglycans, we have these very precious chondrocytes and hyaluronic acid. Okay, so actually I want to introduce you to another product of us. We have this joy feel. It is a type 2 collagen. So if I have my proteoglycans, which covers up 30+%, and my type 2 collagen here, which they covers up 40%, so totals up around 80%. So they covers pretty much 80% of my joint health. Why not? It's actually a very good bargain. Okay, so the Proteoglcan here, they act as a body sponge. Okay, the sponge, they will retain the water and shock absorbent, and the hyaluronic acid as well, they have water as well, so they can reduce all the pressure and the pain. And type 2 collagen, although they do not reduce the inflammation, Proteoglcan does. They act as to increase all these collagen cell here to increase the lubricant, but it takes time. So to give the cartilage the solidity and the resistance of the cartilage. Okay, so where we get this what is so special about this type 2 collagen? Okay, this is our product, Joyfield. Okay, it's in blue. So what we done with father, and this is mother. Okay, their extraction is the same as from the salmon. Okay, the salmon is all natural food. We do not give you some other medication lah. Okay, it's functional food. So what is so special? Because for those type 2 collagen elsewhere, right, other products, okay, their extraction, it can be tricky. Okay, they are exposed to high temperature, high environmental factor, high pH. Okay, so they cause denature. Denature means the changes in the molecular level. Okay, once they denature, okay, they have changes, they coil up. They are not as effective. Okay, but if we are taking undenatured, they ensure the structure is good, is strong, and is original. Okay, with this low temperature extraction, and as pure as 75%. Okay, they ensure this all good, straight, spiral kind of undenatured type 2 collagen. So by these two combination, okay, it can actually gear up or covers up 80% of your joint health. It's not only your knee joint. Knee joint is an example. We have all other joint. So we do not need that much of, it won't be that painful lah. Okay. So these are all these Joyfield. Okay, they are undenatured structure with intact collagen, and it's very, because of the advanced extraction technologies, up to 75% purity. It's very pure compared to the other type 2 collagen in the market. So there's some testimonial. Okay, this is Mr. Chia. He had some contact dermatitis. Okay, for chronic contact dermatitis from some dye. Okay, it is recurrent. He has seen a dermatologist apply medication. It comes on and off, on and off, on and off. So he tried taking Profil, the purple, that Proteoglcan. Okay, and he spray. So, and he spray and he eats, and within 2 weeks, actually, they works very well for all those inflammation, inflamed skin. Okay, and these young ladies, she's having eczema. Okay, eczema is actually a group, is in our gene lah. It is actually a group of atopy disease where usually it is a exaggerated response from my immunoglobulin of my body, is my gene. So if you are an asthmatic patient, okay, I have exaggerated response towards allergen. Okay, I have allergy rhinitis, and most of them are highly associated with eczema. So they are all friends lah. It is a group of disease. Okay, we call atopy disease in our gene. Okay, we can't avoid it. So this, most of you can see the skin, there's a pigmentation, and there's also, it's a chronic skin lesion. It's not new. Okay, that means it's been there on and off, on and off, on and off. So the mainstay of this eczema is cream, topical cream, and to avoid any stimulus or allergen. So they will apply steroids and also moisturizing cream to reduce it. And steroids, as we know that we do not encourage long-term usage over the years, because they reduce, yes, but they will make your skin very thin, so very susceptible to any injury. Very thin skin, you scratch, you do anything, and sometimes they can be flaky, dry as well. Okay, so this is chronic issue. So it have been there for 7 to 8 years for some time. And once it is dry, it be very itchy. Because why I know? Because I have it myself. It's at the flexion area, at the joint area. So after taking Profil, okay, it significant increase the hydration and reduce all the skin inflammation, and that is significant improvement. And I believe that if we have been taking for long term, the flare of this eczema will be much reduced. Okay, like after I'm taking my Profil, I have not have any eczema flare. Usually I have it around my neck area. Okay, when I sweat and my hair irritation, I will have that. So this improve. And this is my a friend, mother of a good friend of mine, Crystal. Okay, so but her speech should be in Mandarin. Later I will further translate for you lah, huh? Okay.
老了了哦，哎，我再去看一下照片一下，是哦，我的斑有很明显的改善了哈、哦，没有之前的这么的糟糕了。然后再过不久，我的脚就开始有一点反应出来，有一点加剧的痛了。之后再过2个星期，我下楼梯的时候，之前我还没有碰这个产品的时候，我下楼梯呀、就是那个楼梯一层一层的，我有2只脚同时到一个梯级了，我才可以慢慢的才可以上下楼梯了。现在我可以很利落的上下楼梯了咯，这就是我吃了这个 Profil 之后的改善了。
Okay. So okay, generally what this madam she meant is actually this a good friend of mine, Crystal, she's from Brunei. This lovely madam is from Brunei. She had been suffering this chronic arthritis symptoms, knee problem over the years. Okay, so her daughter initially bought a set and asked madam to try out. So initially she didn't try out, but eventually she managed to try it out. She realized her pigmentation, her skin changes first. It is obvious it was there. Her skin depigmentized. Her skin gets clearer and nicer, firmer. Okay. But because of the nature of the arthritis, it takes some time to reduce the inflammation. So initially she had some reaction, but I just say, please, you continue. They might have some reaction if your body, certain area, it is weak and there's some issue. So you might have some reaction, but you just hang on and you hydrate yourself properly. What if we do not take enough water? So water, because Proteoglcan, our body makes up for 70% of water. More than 70% is water. So water is a very important medium for everything to work. You want to detox, you want anti-inflammation, you want to sustain your extracellular matrix, you want to do everything. Water is very, very important. So of course, you're taking something good. You want it, the best effect of it. So drink more water. It is 1 + 1 more than 2. It's a synergistic effect. Okay, so take more water. So initially she takes it, she has some reaction. So I said, we continue, just hang on and continue. And eventually, before this, where she walks, she had to go slowly, steps by steps. I think those you have elderly at home, you can see them how they suffer steps by steps, and it's very painful. Every steps is painful. So after the reaction, the Proteoglcan helps in the inflammation, and now she can go up and down the stairs easily. Yes, this looks normal for us, but it's actually a very beneficial for them because they do not feel the pain. Imagine every steps you walk, you feel pain. Oh my! And I do not want a lot of pain control. Okay, so all right, so all these two products, okay, where are they from? Okay, a bit of this company is from Japan. They founded Japan since 2009 by our founder, Mr. Fujiwara. Okay, so although it's 14 years, but they have been awarded for the 3 consecutive years the best network marketing company in Japan. It's not easy. Actually, it's not easy. It's very competitive in Japan, and they does send it globally, meaning that the products are very stable, and they send it globally to more than 120 countries. And this company, they always opt for improvement. Okay, they have a high quality recognition. They have high quality unique products. Okay, they do not just stop there. So there's always improvement from this company. Okay, what I meant by high quality recognition, this is one of the thing I really look into. Okay, so out of the star products, 6 star products of this from this company, Thanksai, they actually being recognized by this JAPA. Okay, so it's a Japanese this adult medicine, preventive medicine for adults. Okay, JAPA. This is a association by 6,600 medical doctors. Okay, medical doctors, Japanese medical doctors. So actually, this association, their main aim is to promote health among the Japanese citizen. So sometimes these companies, they will send products for them to recognize. Okay, so they will recognize the products which is #1 top in that field. So once you have for each category, so once you have this, meaning that our Proteoglcan is #1 in that field. Okay, and they need renewal from time to time. That's why we need to improve the content. Okay, so what are the rules and the regulations to pass this association recognition? First, it must be pure. It must be pure. You can't have any harmful medication for long-term usage or any harmful preservative. Okay, that's why the shelf life for this Proteoglcan is around 2 years. It's not that long. So anything that you can, the shelf life is much longer, maybe 3 to 5 years. Maybe they added something else to stabilize the substance inside. Okay, and they have to make sure it is from natural products. There's no side effects, and clinically they must prove that there is improvement to our health. Okay, and because it is being shipped and sent and transferred globally, they have to ensure the quality and safety of it, and this needs renewal. So we have this constant recognition by this JAPA association in Japan by 6,600 of registered medical doctors. And we have this recognition from Informed Sports from UK. Okay, these are a group, association where they have this dietitian and nutritionist, they for sportsmen. Okay, so with this recognition, meaning that it is very safe for those worldwide global athletes to take, and they have no banned substance, especially and it's good for their joint and bone. Okay, meaning that they have no anabolic steroid, as we know that they are banned substance. So they have no banned substance, it's safe, and it's Muslim friendly. So our Muslim friend, we have this halal recognition. So it is Muslim friendly as well. So anyone, all walks of life, we can actually take this product. And we have a highest form of validation from this PubMed. This PubMed is a medical search engine where you can find various research from global research, okay, about the raw component like Proteoglcan, like type 2 collagen. Okay, these are the main ingredient that we have in our products. So you can search, and this is like they have 50K of different various. There's much more goodness and research about Proteoglcan. I didn't mention, it's too much. Okay, if you have time, you can read. Okay, feel free to read. There's a lot of good research and studies supporting our products. So, so I am sure that the products have multifunction, and the products definitely worth every penny. Okay, rather than I take separate different components to maintain my health. So down to the basic, myself, we take care of our self-health. Okay, so the greatest wealth is our health, actually. No one wish to be sick. And I hope we can share the goodness of health to everyone you love. Okay? Okay, any Yvonne?
Okay, thank you. Thank you so much, Dr. Chia, for your wonderful sharing. So I'm sure everyone today actually learned a lot from Dr. Chia about Proteoglcan, type 2 collagen, and of course, our Thanksai products, Profit and Joyfeel. So I'm sure a lot of people maybe in this call has tried the products and have very good testimonials. Feel free to share with everyone around you and share the goodness to the people around you. It really helps the people around you, your family, your friends, especially those with like skin issues, those with health issues, joint issues. These our products are really top notch from Japan, and it really, really can help them. Okay, so today we thanks Dr. Cha so much for her time. 1 whole hour of a lot of knowledge. Okay, so we actually have a very good promotion this month as well. So actually talk to the person who invited you to this call today as well. So you can ask them what's the new promotion and how do we get started taking the products. Okay, if I'm sure some people have questions, but we actually, due to lack of time, we won't be taking questions today. You can actually talk to the person who introduced you to this call. Let them know some of the questions that you have, then you can raise it up, and maybe we'll include some of the information in the next few Zoom calls in future. Okay, and we also, besides Profit and Joyfeel, of course, Thanksai has other star products like our minerals and our Jogenix. And actually, we will invite Dr. Jia back again to actually talk about our other products as well. Okay, so next week, Monday, we actually have our nutritionist, Shun, to actually talk a little bit more about our products and also about some amazing testimonials. Okay, so next week is same time on Power Monday at 8:30. So, Dr. Chia, do you have anything to add on?
Mm, just around, and thank you everyone for coming. Yeah. Okay. I appreciate
Okay, thank you.
it.
Thank you so much, everyone, for your time tonight. Okay, let's see everyone same time at 8:30 next Monday. Okay, thank you so much. Good night.